Cervical spine, or the spine in the neck region of the body, is a very important part of the spine. It controls not only the voluntary movements, sensations of the arm, body, and legs, but also controls breathing, bladder, and bowel function. We'll be talking about the wear and tear changes affecting this important part of our spine and how it affects us. Hi, I'm Anant Kamat. I specialize in spine surgery. This video is one of a series of videos I'm producing to give information about spinal conditions. This video will cover cervical spondylosis, symptoms of cervical spinal cord compression, and those of compression of individual cervical nerves. I will also cover the investigations, surgical and non-surgical management of those conditions, and when to seek urgent medical help. Cervical spondylosis is wear and tear changes affecting the cervical spine. It can be asymptomatic in most of us, or may present with neck pain, or due to symptoms produced by pressure on the spinal cord or on individual cervical spinal nerves. Cervical spine has function of protecting the cervical spinal cord and supporting the head over the body, but at the same time maintaining flexibility of the spine. This is cervical spine. It has got 7 individual bones. There is the disc in front and a facet joint behind, which allows movement at individual levels. In the center of the bony spine, the spinal cord passes from the top to the bottom, supplying neural function to the body. It gives off through these foramina nerves called as cervical spinal nerves, supplying muscles and taking sensations from the upper limb. As the spine ages, the disc loses its water content, the disc height reduces. There is micro instability at that level. The body tries to stabilize it with bony overgrowth along with thickening of ligaments and capsules of joints. Disc wear and tear changes can sometimes lead to acute soft disc prolapse, which can compress the neural tissue. These changes can lead to narrowing of the spinal canal, causing pressure on the spinal cord and/or the spinal nerves. The pressure can lead to symptoms in limbs. The pressure on spinal cord can lead to a condition called as cervical myelopathy, while pressure on individual nerves can lead to symptoms associated with those nerves called as radiculopathy. Cervical spondylosis is asymptomatic in most cases. The most common presentation is neck pain. It can be an ache or discomfort, or it can be severe pain in the neck. The pain usually extends from the back of the head and may extend all the way between the shoulder blades. It can restrict neck movements. In some, it can be an episode of neck pain, while in others, it can be a long-standing condition. When there is narrowing around the nerves, causing pressure on the cervical nerves, it can lead to pain along the distribution of that particular nerve going down the arm. The area of distribution of the pain can guide the clinician to suspect the involvement of that particular nerve. This pain may be related to the position of the neck. It is not unusual for the pain to improve with time. At times, there can be weakness or numbness in the distribution of that particular nerve. When there is pressure on the spinal cord, it may result in symptoms affecting the upper and the lower limbs. Spinal cord compression can lead to difficulty in doing fine things with hands, weakness, numbness, and stiffness in limbs. Some may struggle to open jars or find it difficult to button shirts or notice that they stumble easily. Very rarely, when there is reduced space around the spinal cord, neck injury may have a slightly increased chance of causing significant spinal cord injury. Such an injury can lead to weakness, especially in the small muscles of hand, and numbness in limbs. It may also cause complete spinal cord injury with complete paralysis and lack of sensation in limbs. MRI is the investigation of choice for this condition. It delineates the soft tissues of the body very well. It will show the changes in the spine, including the pressure on the spinal cord and or the spinal nerves, and may explain the cause of the symptoms. At times, neutral position MRI may not demonstrate neural compression. As neck has a range of neck movements, the pressure on the nerves may be better delineated in dynamic MRI, that is MRI with neck bent forward and backwards. Dynamic X-rays and sometimes CT scans are useful to understand the bony anatomy and stability of the spine, which is useful for surgical planning. CT scan can also demonstrate foraminal narrowing as well as abnormal calcification in the canal like calcified ligaments. Most of the time, the cervical disc disease is asymptomatic and does not need any investigation and treatment. However, there are times when it can be symptomatic and treatment may be necessary. Neck pain is a common symptom and treatment is mainly symptomatic with analgesics and maintaining good spine health. Maintaining good spine health is to keep and maintain good posture at all time. Avoid neck to be in one position for long periods of time and taking regular breaks. Maintaining good range of neck movements and keeping neck muscle in good health with regular exercise as advised by physiotherapist. If the neck pain is persisting for more than 4 to 6 weeks or is very severe and not improving, MRI should be performed to rule out underlying sinister cause. Pain shooting down in the distribution of a nerve can be initially managed with painkillers and maintaining good spine health. However, if the pain persists beyond 6 weeks and is significant, or medications are not helping, or there is weakness or numbness associated with the pain, MRI is recommended. It will show the nerves compressed, causing the symptoms. There would then be the option of either continuing non-operative management or have the option of surgery to decompress the nerves to improve arm pain and reduce chance of progression of weakness or numbness. Surgery usually has good results. When the spinal cord is compressed, causing symptoms of weakness, numbness in limbs, lack of dexterity in hands, balance problems, and the symptoms are progressive, surgical decompression is an option to reduce chance of further neurological worsening. Cervical spine surgery is performed to make more space around the spinal cord and hence reducing chance of further neurological worsening. This operation also has good results. It is important to understand that every operation has risks and limitations, which needs to be fully understood before accepting the option of surgery. I would like to state here that if you do develop rapidly progressive weakness, numbness in limbs, lack of dexterity or progressive balance problems, please seek medical attention immediately. I hope you enjoyed the video as much as we enjoyed bringing it to you. If you feel that this video will be useful to someone, please feel free to forward it to them. If you want to see more of my videos about other aspects of spine, you may wish to subscribe and press the bell icon. Wish you all a very healthy spine and see you all soon.